We're live.
Hey, Michael.
Uh, Thank you for. Does anyone? Thank you for the folks who are joining us already. Just give us a second. Want to let some people get into the room. This is our first weekly update. We will share it as a Instagram reel for those who can't join, but we definitely encourage people to join weekly if they have any questions. Anything you guys want to say while we're waiting for people to join?
Well, how are you guys doing? We could start there.
Welcome, welcome everyone. I'm excited I'll be able to talk to everyone on live today.
That typing's kind of loud, Michael.
Oh, sorry.
No worries.
Sorry, my phone is sitting directly on my laptop.
No worries. No worries.
Okay, it's 12:03, so let's jump. Trying to line up my phone. I want to be centered. um, so I'm Michael. I am the communications and mobilization manager with Prep for All. This is our first weekly update on Instagram Live. We hope to come every week and just give you updates on all of the policy things going on, impacting prep access as well as other HIV policy issues right now. I'm joined with Jeremiah Johnson, the executive director of Prep for All. He's going to give us an update on Kennedy versus Braidwood, the preventive services access case that's currently being reviewed by the Supreme Court, which will could ultimately impact prep access as well as other preventative services. Max is the campaign manager for the Save HIV funding campaign. Due to the current and emerging threats to HIV funding and infrastructure, Max is mobilizing HIV advocates and community members from across the U.S. to push back on these threats. I'm seeing more people jumping in the room. So if you have any questions, feel free to drop them in the chat. We already have some questions for Jeremiah and for Max, and we also got some that were sent in to us. So I'm going to jump in. First, going to ask a question of Jeremiah. For those who are unfamiliar with what Kennedy versus unfamiliar, tell us what is Kennedy versus Braidwood, and why is this case so important to prep access?
Yeah, thanks, Michael, and thanks for setting this up. The policy environment, there's just so much going on right now that we can't hardly keep everyone updated fast enough. So we're hoping every week this will be an easier way. And one of those big things for PrEP has been Kennedy v. Braidwood. It used to be Braidwood versus Becerra, and so it's a bit of a tongue twister all the time. This is a case that's been making its way through the courts, for years now. The first ruling came from a lower court in Texas back in March 2023. But the long and short of it is that, the question that has come to be in front of the Supreme Court is under the Affordable Care Act for Obamacare, the way that preventive services, including PrEP, cancer screenings, screenings related to, cardiovascular health, maternal health, a whole range of different services, is the way that those recommendations have been created, and the way that that law is enforcing full coverage without cost sharing for preventive services. So that means for all of us, we're on, for those of us on private insurance, we go to the doctor. These are services that you're not supposed to pay at all for, because it's supposed to be good for us as a whole in society. So the question is that process unconstitutional? Does it violate what's called the appointments clause within the Constitution? And if so, that endangers those protections. And so, like you said, Michael, for those of us who are PrEP advocates, we're very concerned about what this means in terms of people having to pay more out of pocket for PrEP. And we know even just a small increase leads to, a doubling of the number of people who won't pick up a PrEP prescription going forward. But ultimately this could impact cost sharing and hit people. 150 million Americans could be affected at a time when you're already having to pay for more out-of-pocket increases for all sorts of things in the U.S. These tariffs are going to be hitting all of us real hard, really fast. And this is another way that you might get hit in your pocketbook if these protections go away. And so that's what we're concerned about. And we're concerned not just for PrEP, but for preventive services across the board.
Thank you for giving us so much background on that. And we're kind of shooting rapid fire and doing it real quick. But just want to add more context. Where are we currently with Braidwood?
So last Monday, the court heard oral arguments in the case. We weren't in the room, but some of our partners at Lambda Legal and others were in the room. Right now we're in this period where, we sort of saw what happened in oral arguments. The court is assessing those arguments, requesting additional briefing, and we're anticipating we'll get some sort of a decision late June, possibly into July. Right now, based on the oral arguments, advocates are, what we're hearing, cautiously optimistic about the case and where it's headed. What we're hoping is that we're going to see a big win in this case where they say that basically the way that these recommendations have come about are fully constitutional, and all these protections that we've been seeing between 2010 and now are still valid. But the challenge is oral arguments don't always translate into where the court ends up going. And also, importantly, in the case for the oral arguments, there was a lot of focus on sort of constitutionality and this appointments clause. Not a lot of discussion about the impact on communities and real lived experience. And so right now, even though we're cautiously optimistic, it is incumbent on all of us and advocates to be uplifting right now what the impact of this ruling could mean in the case, what it means in terms of our lived experiences, how it could impact our health. Because while we can't lobby the justices directly, we do know that they pay attention to media coverage. And so that's where advocates are going to be really focusing in the next couple of months, and we're really encouraging everybody to keep up to date on this case, keep following PrEP for All, and help uplift on social media and through to traditional media what's going on with this case.
Thank you. And to keep up with us on social media, definitely if you are watching this live, if you're watching it after we post it as a reel, make sure you share it to your Facebook stories so that more people can follow PrEP for All and know about the great work that we're doing. So I'm going to pivot to Max, who's recently stepped into the role as campaign manager for the Save HIV funding campaign. I'm saying recently, but it feels like you've been doing like a lot of work. So it seems like you've been around doing this. You've done so much in a short amount of time, so it doesn't seem so recent. And so we definitely want to thank you for that. So Max, tell us about what are you doing in your role for Save HIV funding, and what are the current threats that Save HIV funding is addressing?
Thank you so very much for introducing me, Michael. My name is Max Boykin. Like Michael said, I am the campaign manager for the Save HIV funding campaign. What I've been able to do since joining us in February is a couple weeks after Trump was became president of the United States again, was that we got into it and understanding what were the cuts that were at the worst that could happen under his administration. And what we've also seen is we've seen some of the worst things at least start in the cuts that they've done around HIV funding. They have cut the CDC's Division of HIV Prevention, which is Department of HIV Prevention. That is one of the proposed cuts. Serious proposed cuts to HRSA, and the hundreds of key positions eliminated there. Um, Hold on. I'm getting a little bit of an echo, so I just want to make sure that's not on me. But we're
First
also
broadcast, y'all. First broadcast.
yes. Um, one of the things that we're also seeing is attacks on the Office of Infectious Disease Policy, and that is another one that has been under attack. The Minority AIDS Initiative is to be looked to be zeroed out. Attacks on SAMHSA, which is Substance Abuse and Mental Health Services Administration. Sorry for all the acronyms, but we're also trying to make sure that we're educating folks and they understand what all these cuts are to, and then also cuts to the National Institute of Health, or NIH. And with this, we also are seeing a large cut around Medicaid. And Medicaid is the largest source of health coverage for people living with HIV. And that is one of the reasons that we are trying to push back against those cuts. And one of the things that we're going to do is we're constantly getting our advocates to be able to be advocates for the summer. I mean, we're just like kicking off a summer of advocacy. May Days was yesterday, and we wanted to uplift that as well, as fight for immigrants' rights, for the rights of workers. But we also understand with these attacks around Medicaid, this impacts our ability to be a healthy country, and impacts our ability to give people access to PrEP and to HIV services. And so one of the things that we're asking for folks to be able to do is reach out to Congress. We know that our partners at AIDS United had a wonderful action alert come out. And then we also have a 5-call Medicaid alert that we also recently came out to tell your legislators no cuts to Medicaid can be included in any of the reconciliation bills, which we have seen for fiscal year 25. And they're also, we just got a chance to see the president's budget for fiscal year, the skinny budget for fiscal year 26. And one of the things we want to continue to let our legislators know is that these proposed cuts and the cuts that they're proposing for 2026 are a no-go and will not help us actually end the HIV epidemic. So we want to make sure that we're letting our legislators know. And we're also coordinating different levels of actions that folks are taking both in their local communities along with in DC. And we've just also supported folks that have been doing in-district meetings across the country, and we'll continue to do that throughout the summer, and having local conversations with their legislators to understand why it's important for them not to cut HIV funding. But one of our biggest things that we are continuing to push right now is that we need to make sure that folks know, and our legislators know, that we cannot have cuts to Medicaid. That will not make it easier for us to actually end the HIV epidemic.
Thank you, Max. So definitely just highlighting some of the work that we're doing, really pulling communities together and keeping advocates updated, because like just as Max talked about the budget, we literally just, as we were getting ready for this live, we literally just saw the budget within the last hour. So we're constantly having to stay on top of these things. So Max, can you tell us how people can get involved outside of just watching the Instagram live and following us on social media if they want to stay up to date with everything that's going on with the Save HIV funding campaign?
Yes. So we have a weekly call every Tuesday at noon for advocates, people that are directly impacted, people that are working in the field, to be able to come in, be able to get updates, and also hear about different actions that we want to make sure that folks are being able to take. We want to uplift the teach-ins that ACT Up Philly are doing, and the one that San Francisco AIDS Foundation is doing. We also want to uplift Latino Commission on AIDS, along with uh, Southern AIDS Coalition is also doing an update next week as well. And we also know that there will be also a series of actions that are going on next week to continue to push back against the budget process.
Thank you. Trying to put the link to sign up, and sorry, I'm doing technical and hosting at the same time.
Thank you so very much for doing that, Michael. I know that is not the easiest thing to do. And I know I couldn't do it at
On the
all
little
right now.
phone at
Yes.
that. But I just dropped in the chat. So if you want to sign up for the Save HIV funding calls that are facilitated by Max every Tuesday at 12 noon, you can go to that short link and sign up for that. Okay, so one of the questions that we got actually on LinkedIn when we posted that we'll be doing our weekly update, I'm going to pose this and either one of you can jump in. It's a two-part question. What are the next steps in terms of PrEP data given the recent CDC reports, and how does the lack of most recent data fit into our advocacy efforts?
It's a great question. I'm happy to jump in. We're very concerned. If we can't have proper surveillance, if we're not counting people, then they become invisible in terms of our ability to address disparities. The reality is that if we weren't able to see that certain communities are being shut out of PrEP access, we wouldn't know to tailor our national response to try and get PrEP to more of those communities that aren't able to access it at this point. So we've already been behind the ball in terms of PrEP stats because the CDC was already sort of reconfiguring its methodology around PrEP surveillance. Now the branch of the Division of HIV Prevention that was focused on that has been eliminated. There's no staff there as part of these DOGE-driven, reductions in force. And so, our concern right now is understanding, is there a pathway to get that surveillance back on track? We need to be elevating it with policymakers, and we intend to do so to understand how is this going to fit into all of this. But to Max's point, around saving HIV funding, we're going to be in the fight for our lives headed into the rest of the year with this so-called skinny budget that's just come out from the administration. They've already started cutting all of these offices, cutting these positions. For the next part of this for FY26, they're looking to codify it and eliminate any questions of impoundment, constitutionality, so that they're free and clear to basically just deprive our communities of the resources we need to keep ourselves healthy. And so, this is just one of the immediate consequences we're seeing. It's why we're going to keep fighting to elevate that alphabet soup of offices that Max was talking about. Let everybody know why it's so important that we keep these offices functional, and then make sure that our policymakers know that we absolutely cannot turn our back right now on PrEP surveillance and all of the national PrEP response in terms of being able to get PrEP to every community that needs it.
Thank you. So we talked about the Save HIV funding calls. What are some other ways that people could get involved with our advocacy? I'm going to throw in one first, even though I'm asking a question. So I work on a program called the PrEP Users Union, where we actually use PrEP user stories to actually talk about these different policy issues and why we need policies that increase access to PrEP and why we can't afford to cut funds for these services. So if you're a PrEP user or former PrEP user or someone who's run into barriers with accessing PrEP and you want to share your story and get involved, you can visit prepforall.org/PrEPSaves. You can look at some of our campaign videos. We're actually about to launch another series of videos soon, and if you look at it and you say, hey, this is something I want to do, I want to share my story, or I want to get involved in these discussions, not only do we share stories, we try to put people in contact with legislators and stakeholders so that they can actually uplift these policy issues as well from a personal standpoint, which is very important. So you can go to prepforall.org/PrEPSaves and sign up for the PrEP Users Union. Or if you don't want to, if that's not for you, but you just want to look at the videos and share our videos and uplift those, you can also do that by going and watch the videos on the webpage. And gonna pivot to you guys on how we can get involved. Other people can get involved as well.
Yeah, one of the things, just also of the stories we at AIDS Watch, which was at the end of March, beginning of April, was a wonderful chance for us to also collect people's stories on how the impacts of these funding cuts have impacted them. Look out for those stories and other options about also being able to share your story about how HIV funding cuts are impacting you, coming out later on this month. Also, look out for a training for folks to be able to have teach-ins, to be able to communicate and learn about how in which these funding cuts actually impact people on the ground. And then also, one of the big things that we're going to continue to push is having in-district meetings with your legislators if you have a chance. Reaching out to your elected officials, both on the federal level, but also on the state level, to talk about why they need to not cut HIV funding, why we cannot cut Medicaid, and why we actually need to increase access to HIV funding, and to be able to actually get to the point of something that this administration has talked about, which is talked about ending the HIV epidemic, which we consider one of the most important things for us to be able to do. But that means we can't have all these funding cuts. That means we need to educate more folks in our community, need to talk to more of our legislators about why they can't have these cuts. And then there will also be a number of different actions that people are presenting for the summer, and you will be able to eventually look on our eventual website to see where you can also join into those actions in the future.
Thank you. And there's one question in the chat: is it just for the U.S. or those in other parts of the world? So we, with the Save HIV funding campaign, we also partner with other organizations. One of our closest partners, right now we do domestic work in the U.S., but one of our closest partners, AVAC, does a lot of global work as well. So you can visit avac.org to learn about the great global work that they're doing around access as well. And it looks like Jeremiah has a comment.
Yeah, well, also, yeah, Max, you read my mind as well. Health Gap, Housing Works. I think a lot of people saw the 200 or so coffins that were placed in front of the State Department in DC a couple weeks ago, and so definitely uplift their work and encourage you to follow them. I think you guys covered it for us, though, but if people have other ways that you want to plug in or just questions for us, it's very easy for you to get at any of us. It's just our first name at prepforall.org. Jeremiah's a little tricky to spell. Max has two X's. Michael's pretty standard. But you can get to us pretty easily, and we can plug you in if you have additional questions.
And you can sign up for our e-blast at prepforall.org.
Agreed.
And while we're talking about prepforall.org, you can also go to our website to make a one-time or recurring donation to support our work. One of the reasons that we are able to rise to the occasion and push back on these immediate threats as they arise is because we do not accept federal funding or corporate funding, especially pharma funding. So when these threats to PrEP access and HIV treatment arise, we like to be able to jump right in, not have to stifle ourselves or bite our tongues when it comes to our advocacy. But we're only able to do that with supporters like you. So you can go to prepforall.org and hit the donate button and also make a one-time or recurring donation to continue to support our work. So as we wrap up today, going to also talk about each of us is going to go ahead and recommend an article or a piece of news out there that really just highlights the importance of the work that we're doing. Obviously, with Instagram, it's hard to click links, so you can actually go to our website as well and go to the news and publication section where we've already listed these articles. One article I'm going to uplift this week is from The Advocate, which talks about Kennedy versus Braidwood. I'm just like Jeremiah. I'm still trying to get out of
It's
the habit of
tricky.
saying
It's
Braidwood versus
tricky.
Becerra. But Kennedy versus Braidwood. And it actually includes quotes from our partners at Lambda Legal, CHLP, CHOPE, as well as we did a series of videos that we recorded with PrEP users, including Max and myself. I saw Jason in the chat; he was included as well. And those video, and thank you to The Advocate for not only doing an article about the important work that we're doing around Braidwood, sorry, Kennedy versus Becerra, Kennedy versus Braidwood, but also including those videos in their piece as well, because it really adds that personal touch of why we're doing the work that we do.
Great. So on my side of things, uh, we've been following a lot of the great sort of infographics and coverage that AIDSview.org has been doing around some of the federal HIV funding cuts, what is at risk, and encourage people to go and check them out. It's aidsvu.org. Always just some of the best visualizations, and you can see state by state at the bottom of their recent post on domestic HIV funding, what's at risk from CDC and HRSA funding that could be cut, and highly recommend that. And then I'm throwing one quick curveball, Michael. I didn't tell you that I was going to mention this one, but I also encourage people to read up on the recent settlement between Gilead and the federal government for violating federal bars on kickback statutes. So basically, Gilead, by paying for an HIV speakers program between 2011 and 2017, they ended up basically the government found and Gilead ended up admitting wrongdoing in this. That they sort of influence these prescribers to prescribe more of their products. And so it settled for $202 million from the company, and encourage people to read up on that. One thing that we're going to be talking about is, can those funds be put towards something useful in terms of HIV prevention in the US? So that's what I'm reading this week.
Thank y'all both for what y'all just brought up. I'm gonna bring a little bit more of a contemporary one. Last week tonight, John Oliver, if you have HBO or Max, to be able to watch it, but it's also on YouTube. RFK Jr. and HHS, he does a wonderful job of breaking down the cuts to HHS, how in which RFK Jr. has been planning this out. There's also a one that you can watch that he does just on RFK Jr. if you want to hear all the wild things that he thinks while he was running for president, and also what he thinks about all the health and human services things he wants to change. But this is a really good chance to also see what has been going on, how this impacts our health and human services long term, all the things that the administration is planning to change. So, and it's funny. So it's always a good laugh to have as well, as he is breaking these things down. So get when you get a chance, check that out over the weekend, and they'll probably have another.
Thank you. Wow, we said 15 minutes, but we're just at the 30-minute mark, so I may have to go and re-edit that flyer because I definitely think we have like so much to say that trying to contain ourselves in 15 minutes isn't going to be enough.
We're
But
talking
thank you for everybody
much.
who's been in and out of the chat, joining us. I've seen several people popping in, staying for a minute and leaving, and more people popping in. So you will be able to view the full live as an Instagram reel. So definitely thank you. Continue to share and join us next week at 12 noon Eastern time. Thank
Thanks,
you.
everybody.
Thank y'all so very much.
Have a great one.